NADH and cancer is a very important subject, and I just want to outline you what the different theories are, how the cancer develops. Either the cancer develops from genes, from the nuclear genes, or from the cytoplasm. But let's take the carcinogen binds to DNA, and if there is no repair, you get a mutated to repressed DNA, which promoters like smoking, like any kinds of other toxin, enters into altered mutated cells, and then cancer develops. But you can interfere with this reaction. If you have no repair, if you give NADH, you have DNA repair, and you end up with normal DNA. If you have anti-promoters, and I showed you at the beginning that NADH is an anti-promoter, you don't get cancer. And with the altered mutated cell, you can increase cellular energy. And this is what I keep saying to my students. This is a cancer cell. Very low in ATP. ATP is the chemical stored form of energy in the mitochondria. And cancer cells have low energy. They have low mitochondria. They have no power plants in their cell. And therefore they cannot produce all the substances which are essential for cell regulation. But if you get NADH into the cell, as we have shown, then the cell makes more ATP. But more important, it has enough energy to make cell surface compounds. And these cell surface compounds control the cell regulation. They control whether a cell will divide or not. And the more ATP you have, the better this function works. So I want to demonstrate one or two patients, and then the summary with all my patients. 2 weeks after September 11, a manager from the Netherlands came to my office in Vienna. And his professor in Amsterdam told him, make your last will, you will not survive until Christmas. He had chemotherapy, as you can see, all kinds of radiotherapy, nothing helped. It was a tumor very close to the heart, and it was inoperable. He started with NADH, and 40 milligrams, which we now know is even too low. And in July, 9 months later, no tumor detectable. And March, I called him because I wanted to invite him to a lecture where I invited all my cancer patients. And he said, sorry, I can't come, I'm too busy. But most rewarding for me is that he writes me every year a Christmas card. This is much more rewarding than any prize. And I have another patient, a female, bronchial carcinoma, November, a year ago, and the control, computer tomograph a month later, and it shows there was a 5 centimeter tumor on the apex of the lung, and a small other tumor. This patient took 160 milligrams, 8 tablets of our rapid energy, and the small tumor could not recognized anymore. So the tumor was gone after 4 weeks. And the big one was centrally necrotic. So something happened, maybe the immune system or NADH, which destroyed the tumor. And that says centrally necrotic tumor. That means NADH had effect in destroying tumor cells. Now, another patient with a non-Hodgkin lymphoma, he had all kinds of chemotherapy and also radiotherapy, and it did not help until January 9. And this is a remarkable slide. He came to my office and showed me a lab report. And I said, who did this red circle? Because it says the white blood cells were 4.6, the red blood cells 14, and so on. And I said, was it you? I said, no, it was the doctor. Because the doctor was surprised that under this heavy chemotherapy, the blood cells kept normal. That means if you are on chemotherapy, NADH will protect you from the side effects of NADH. And this is, I will skip that slide. He said, then he stopped with NADH, and the tumor came back after 9 months. And they had a biopsy done, it was the same tumor. And then they said, you have to make chemotherapy again. And I said, no, I will stick to Dr. Birkmayer's philosophy, I only take NADH. And now, October of this year, no evidence of lymphoma. And he started 11, so that means for 2 years he's now no evidence of disease. And this is a summary of all my cancer patients I have treated since 2009. We had 21 prostate cancer patients, no surgery, no chemotherapy, no radiotherapy, and to explain it a little bit further, TR means tumor regression and TF means tumor-free. So prostate cancer, mammary carcinoma, lung cancer, colon cancer, we have also bladder cancer, non-Hodgkin lymphoma, brain tumors, and gastric carcinoma, as well as pancreatic carcinoma. So this is the same in English, sorry. And based on my results, I was invited by Dr. Harry Bruce and Ali to write an article about NADH in cancer prevention and therapy.